All right, so the vaccination process also got underway in the Eastern Cape. SABC News reporter Lerato Fekisi was keeping tabs on that for us in Port Elizabeth. Good evening to you, Lerato. Thanks indeed for your time. So how did the rollout of the vaccine go in the Eastern Cape today? And what was the general feel from the health workers who got the first jab?
Good evening to you, Crisalda. I could say it was really a successful first day of vaccination rollout in the Eastern Cape. About 8,120 vaccines arrived this afternoon. 3,200 of those will go to the PE Livingston Hospital, and the rest will go to Mthatha Nelson Mandela Academic Hospital. We actually got to see the first jab for ourselves. One of the ladies, the first lady to get the jab was Darlene de Vos, and she's a health official at Livingston Hospital, and she said that it was important for her, as someone who is heading the health facility there, to make sure that she sets a good example by showing other health workers that, you know what, it's okay to take the vaccine, and if anything, you must take it to protect yourself. A lady after her also followed, Mrs. Ludig, and she was also saying that she was a bit anxious. The needle is quite big, but after she took the vaccine, she felt fine. And if anything, she also just reiterated the importance of taking the vaccine, especially at a time right now where we're in a second wave and things in terms of infections are also increasing. So both health workers very optimistic, but also just appealing to other health workers to go out there and do the right thing, which is to get the vaccine.
Yeah, so the Eastern Cape, obviously very vast province, predominantly rural. What plans has the Provincial Department of Health have for those in the far-flung areas?
Crisalda, you are from Eastern Cape, and you know that the Eastern Cape is not just made of urban towns such as Port Elizabeth, but there are towns like Lusukisiki, Kuqumbu, far-lying areas which don't have health facilities in close vicinity to them. So the plan is to actually have the vaccines rolled out at schools within 5-kilometer radius from where people stay. So they're going to use schools and also use clinics and other community centers, so that people that are staying in such areas can walk to a school, can walk to a community center, to make sure that everyone, no matter how far area you are staying, you can still get the vaccine. And obviously for people that are much older, they've got people called vaccinators who have been trained for the past 3 months, who are going to go out doing a house-to-house rollout in people's homes, especially those who can't travel because of health conditions.
Yeah, while the process starts with healthcare workers now, did you get a general sense, from the residents on the arrival of the vaccine itself?
Yeah, the people, especially the people that we talked to before we got to Livingston Hospital, were obviously very much optimistic. People are saying that, you know what, if there is something that can assist us in fighting this pandemic, then definitely please do go get the vaccine. So the general feel from people is that, yes, they are obviously mixed emotion because it's something that we've never heard of before, and obviously of stuff circulating on social media. But generally people are saying, you know what, we've lost so many loved ones, we've lost so many people close to our hearts, and if there is something that can help us stop death due to COVID-19, then we'll be first in line to take the vaccine.
Lerato Fekisi, thank you very much indeed. SABC News reporter joining us live from Port Elizabeth.